previously on bodies.
What do you prescribe her?
Amoxicillin, 500 milligrams IV.
Why didn't anyone know about her mum being allergic to penicillin?
It isn't my fault. Whose is it?
She will not appear in my figures. No bloody way.
I'm married. I can't do this.
So you're saying you are not suffering from a psychiatric illness?
I tried to bring to their attention a catalogue of medical errors committed by Roger Hurley.
I want Hurley to look me in the eye, admit what he did to Karen and say he's sorry.
Karen Taylor's medical notes aren't available to us. The hospital maintains they've been lost.
I thought this was going to be about the Taylors.
The case we're dealing with is yours, Rob. Your negligence, not mine, and I've proposed that you be put on extraordinary leave from my firm.
It's you this should be happening to, Roger. Not me.
In the last 7 days, how many times have you had sexual intercourse?
1 time.
On a scale of 1 to 10, 1 being the lowest possible, 10 being the highest, how would you rate your level of desire?
5.
Level of arousal?
3.
How would you rate your level of orgasm?
2.
You ever been to St. Lucia?
No.
It's where they're holding the 2nd annual symposium into female sexual dysfunction. Being Stornoway Carroll have said they'll fly me and 1 member of my team out there. Do you fancy it?
Sounds great.
Well, I'd like to give them a preliminary presentation this week.
I'd have to say the data at this point are far from conclusive.
Data's crap. I cannot show crap to BSC.
The results are what they are, Mr. Whitman.
They have promised a cappuccino machine for the surgeon's lounge, and they're going to build a swimming pool in my back garden shaped like a vag.
Wonder if I can ask you the questions again. I shouldn't be telling you this, but the drug company is planning an even bigger trial later on in the year, and subjects who've responded well to this course of treatment will be given priority when being put forward to the next trial.
So I'd get paid to take the drug again?
The trial would be bigger, so the fee would be higher. So how would you rate your level of desire?
7.
Arousal?
8.
Orgasm?
9.
Okay. Come in. Who is it?
You all right? I've been bleeping you.
They took me bleep.
I thought they'd kicked you out of this room already.
Well, that would require one department successfully manages to communicate with another in this hospital.
What are you going to do?
Nothing I can do. Will you come back tonight after work?
I don't know, maybe. You don't deserve this. You're the only person who has stood up to Roger. You saved patients he could have harmed.
Morning.
Morning, Tony. Everything all right?
Well, I hope so. How are my figures looking?
Okay.
Well, what's wrong with them?
They're a little down. Only a little.
Down? What, you mean as in up?
There's a few more complications this month, yes.
Oh, God, it's the royal visit this morning. Shit. Upcode the risk factors to make my results look better, thank you. Smokers, far greater risk of complication. So, codify more of the patients as smokers, and the number of expected complications goes up, and actual numbers look better in comparison, don't they? Oh, here's one. You see, gave up smoking 15 years ago. Well, I bet she still has a sneaky fag now and then. Recodify her as a smoker.
Upcoding. This This month's complication rate for the Whitman firm is 16%, which is an increase on last month's figure, which was 12%, but a rise of only 4%.
4% is an absolute figure. The relative rise is 33%. A more appropriate measure, I'd say.
Fuck me, Roger. Hold your horses. Let her finish.
However, this month we saw an increase in predicted morbidity from 15% to 20%, meaning the Whitman firm's actual morbidity rate is 4% below the national average.
Or, if you use Roger's way of looking at things, a whopping 25% below the national average. Last month's deliveries by cesarean section, 21%. The Department of Health's target is under 20%.
2 units within this health authority have reported rates of 15%. Our target should be 15%. Why the hell isn't our target 15%?
Adults. Oaths. For those of you who haven't already met him, I'd like to introduce our unit general manager, Mr. Paul Tennant. Mr. Tennant is paying his occasional royal visit to the ONG M&M meeting. Back to the CS figures. Now, here is the firm-by-firm breakdown. As you can see, Mr. Hurley is 23.5%, Miss Sharma, 21.5%, Mrs. Keatley, 21.5%, Mrs. Obi-Nadozi, 20.5%, Mr. Kumara Atney, 20%, Mr. Whitman, 18.5%.
Tony, sorry, but going back to your complication report, according to figures returned to the ONG Clinical Directorate, we have one of your gynae patients, Louise Weiser, reported as being transferred to ITU following respiratory arrest.
She wasn't my patient.
Whose patient was she?
Rogers.
Actually, Tony, that's not strictly true.
It was your SHO who gave her the wrong antibiotic. Why should she appear in my figures?
My understanding is that the chain of events leading to a present condition was more complex.
The critical error was the antibiotic.
Yeah, there was a chain of errors, not just Myers.
Don't tell him, Pike.
There was a chain of errors, not just the SHOs, which put the patient into a coma.
When the shit hits the fan, everybody ducks. Some people duck a little bit faster than others.
And that when things go wrong, people find it easier to blame an individual rather than look at how the system failed.
You're right, Roger. It is easier. When in doubt, blame the scapegoat.
Sorry about that, Mike.
Okay, bed 13, Surinder Kaur, age 59, under Mr. Hurley, CA ovary. Surinder had a comfortable evening. She's no by mouth for theatre in the morning.
Sorry if this is a bad time and that.
We'll only be 10 minutes.
That's all right. How can I help?
I was hoping to speak to Rob Lake.
Mr. Lake's on leave. Hello.
Hello.
Have you started school yet?
What do you think?
Oh, you cheeky wee monkey. He's my mobile if you see him.
All right, Shelley. What?
You don't know?
No, what? Okay. Bed 14, Michelle Fleet, age 22.
Maya, what are you doing here?
It's my fault. She's a cabbage.
There were lots of mistakes.
Are you trying to make me feel better?
We all kill a few patients when we're starting out. If every doctor who messed up was lost to this profession, then there'd be no one left to staff the hospitals. You're Louise's daughter, aren't you?
Shelley.
I'm Polly Gray. I'm one of the obstetrics and gynecology registrars. We've been having a look at your mother's charts, and I'm afraid there's no improvement.
There was something I wanted to talk to Dr. Lake about.
Can I help?
I had this idea. I've seen in the papers that sometimes they use a celebrity.
A celebrity?
You know, someone the coma person's really into, and hearing their voice brings them out of it.
Right.
I was thinking of Eminem.
By all means, bring in a CD or a tape. Be sure to clear it with a member of staff before you put it on.
Could the hospital get him to come in? Do you think he does hospital visits?
We'll look into it.
Thank you. Come on.
My sister Rick's there, please.
Who is this calling? Who is this?
Hello, Helen. Helen, my name's Tim Sibley. I'm the A&E Senior SHO. I'm going to be looking after you from now on, OK? Because you're pregnant, I'm going to call someone down from obstetrics straight away.
She's 36 weeks pregnant. We need a registrar down here.
Yeah, I'm trying. Rob's not answering his bleep.
Rob's on leave.
Rota says he's on call.
He's not.
Who is that?
I don't know.
So Hurley's firm's on call, but Rob's not, and no one knows who's covering.
Call Roger.
You call Roger.
I'll bleep Polly. Where does it hurt? Does your tummy hurt where the baby is?
Oh, my.
Her membranes have ruptured. Aren't we supposed to give Anti-D now?
What are you asking me for? You're the gynae.
I'm not sure. Anyone know? A&E. Polly, great. Listen, with Rob being off, I didn't know who to call. We've got a woman down here, an RTA. She's 36 weeks pregnant. She says to call labour ward for them to send a midwife down with a CTG.
Could you call the labour ward and get me a midwife down with a CTG?
And an ultrasound scanner.
Could you get me an ultrasound scanner as well, please?
Okay.
Her contractions have started.
Now she's starting contractions. Time them.
4 minutes 30.
Nice watch.
Uncomplicated tibia, C-spine and AD. The orthopod said that they'd be happy to fix the tib later.
80 over 50. We've got to pump more fluids into her. Where's trauma?
Get whoever's on for trauma and a couple more units of clearance. Do we have a sonic aid down here?
Sonic aid.
Where's the wedge?
What wedge?
Cardiff wedge.
What's a Cardiff wedge?
Look, I'll see if I can find one.
Help me roll her. Okay, Helen, we're just going to roll you over. It's better for you. Here we go. 1, 2, 3. The wedge goes under here. Your waters are broken and they're bloodstained, but that doesn't necessarily mean that the baby's been harmed. Thanks. Repeat her BP. Right. Lying on her back, the uterus presses on the IVC, limiting venous return to the heart. So it's no wonder her BP was so low. That's your baby's heartbeat. That's a good, strong heartbeat. I'm going to have to examine you internally. Is that okay? If you could lift up her load. Okay. There we go. Sorry. There we are. Just need to feel your cervix. Sorry, all done, all done. She's 45 centimetres dilated.
We don't do wedges anymore, but I found a pillow. Will a pillow be all right?
Let's put you in there. CTG's here.
Okay to put it on?
Yeah, go ahead. That's in here.
Contraction, slight dip.
Everything's looking good, Helen. Your baby's looking good. How's that trace looking?
I'm still seeing slight dips.
Okay, organise an urgent transfer to maternity. Mr. Hurley, thanks for coming.
Sorry you've been dropped in it like this, Polly.
This is Helen Moore.
Hello, Helen.
She's 32 years old, 36 weeks into her second pregnancy. The first was a normal vaginal delivery, no problems. She's been involved in an RTA, membranes ruptured, contractions started. The amniotic fluid was blood-stained. The ultrasound showed no fetal trauma. Theatre's ready for her now.
So you're going for caesarean section?
Yes.
What's the position?
Occipito-transverse.
She's got an unstable pelvis?
No, but, she...
Just a film?
Yes.
It's like a straightforward fracture to me.
With respect, Mr. Hurley, she's been involved in an RTA. There are dips on her CTGs. I think...
Let me have a look. Non-neurovascular compromise. Those dips aren't too bad. What's a V? 4 or 5 centimetres?
Yes.
Well, you know that multips can progress very quickly to full dilatation. I don't get your rationale for ruling out a trial of labour.
I don't think she's got the energy to push the baby out, which isn't good for her and isn't good for the baby. I can do a CS in 20 minutes, skin to skin. The baby's out and safe, and the orthopods can get on with fixing her leg.
We're doing too many caesarean sections. This woman has a stable pelvis, should dilate up quickly, and the signs of fetal distress are equivocal, to say the least. She can deliver vaginally.
Push! Push, Helen! Big push now!
Come on, Helen, you got to push, and this little fellow will be out in no time. Big push for me now, Helen. Come on.
Push!
Will you push for me, Helen?
Push! Big push, Helen! Come on!
Come on, you got to push, Helen.
Push!
Come on, Helen. Big push. Big push. Big push now. Push, Helen. Big push. Come on. Big push now.
We were all set to deliver by CS ages ago. By now, the baby was starting nursery.
Come on, Helen. Big push.
Who the hell uses Keelan's forceps outside a theatre?
Come on, Helen.
We'll go in there, and between us, we'll persuade him to transfer her to theatre for a section. He'll back me up. Sorry.
Big push, Helen.
Push, Helen!
Big push, Helen.
Hurley is pulling on a set of Keelan's like he's reeling in a marlin, and something is going to happen to that baby, and something is going to happen to that mum. Please, you've got to come up there with me.
Why are you bothering with all this? You've never bothered about Hurley before.
Well, I've never been in this situation before.
It's not my problem.
Chin to chest, Helen. Come on, you've got to.
Mr. Hurley, I'm
sorry, but it is contrary to best practice to use Keelan's forceps out of theatre. I strongly recommend that we transfer this patient immediately.
I know what I'm doing, Polly.
But Mr. Hurley...
Get out. Big push now, Helen.
Push for me, Helen.
Big push, come on.
Walk with me. If you're my registrar, I'd kick your ass out that door right now. You're Tony's, you're his problem.
Mr. Hurley, given the
Don't. Just don't. Is the father here yet?
I don't know.
You talk to him when he arrives. The good news is they've got a bouncing baby boy. Bad news is she's written off the Peugeot. Now fuck off.
There was a well-defined area of CIM which...
I'm not on extraordinary leave, not yet, anyway.
You stupid cow. I'm already without a bloody SHO. How am I going to manage if they come down on you?
I thought he was going to cock up the delivery.
And did he?
No.
Rob's got you believing that everything Roger does is a catastrophe.
It looked like it was going to become a catastrophe.
Oh, and did the cervix dilate as quickly as he said it would?
Yes.
And the dips on the CTG, they didn't turn into anything pathological?
No.
And he dealt with the OT presentation by using Keelans?
Yes.
Well, it wasn't a bloody catastrophe then, was it? Polly! Not for Roger Hurley! Bollocks! Now, I will have to square it with him. I am the frigging principal consultant, and I will have to go down on my knees to him. Bollocks!
I'm really sorry, Tony. Sorry.
Okay.
Gynae. Staff nurse Briadova. I'll tell her. Donna, that was pharmacy. You are late for drugs budget meeting.
Oh, thanks.
And Mrs. Pringle is in the office.
What does she want?
Biscuits? Chocolate?
What can I do for you?
Shut the door, please, sister. Mrs. Pringle has received a serious allegation.
What sort of allegation?
Racism. Towards a visitor.
By who?
By you.
No way. What am I supposed to have done?
I'm not at liberty to disclose the precise nature of the allegation.
Who says I'm racist?
I'm not at liberty to disclose the name of the plaintiff. Needless to say, we take it extremely seriously. An investigation's underway, and you'll be notified in due course if there's to be disciplinary action.
Got something for you.
What's this?
Well, what does it look like?
I know, but why?
So I can call you.
Oh, I'm sorry, Rob. I can't accept this.
Why not?
Because he might find it.
Who?
You know who?
Well, then say it.
My husband might find it.
I've got no way of getting hold of you. I stayed in here all last night.
I said I probably couldn't make it.
You were with him.
Yeah,
Couldn't get away.
it was his birthday.
Well, you could have tried.
It was his birthday.
Do you still sleep with him? I often wonder, but never asked. Do you still sleep with him?
We sleep in the same bed.
Do you fuck him still?
That's none of your business.
No, I think it is. Do you still fuck him?
No, it's not about that. This is complicated for me. This is about how I feel about you, how I feel about him.
Do you suck his cock like you suck mine, or is that a bit complicated for you as well? Wait. I need to talk to you. There may be a way that I can get my job back, but I need help. I need you to help me.
I can't get involved.
Donna, months could go by here. Years. As a doctor, I'd be completely finished. This is my best chance, maybe my only chance.
You don't speak out. You don't put your head above the parapet. That's how you survive. I'm sorry, Rob.
I'm prepared to testify against Mr. Hurley on behalf of the Taylors.
I'm afraid the latest round of communication with the hospital doesn't augur well. They've actively discredited Dr. Orton, and I think they're trying to do the same with you. Sorry to bring this up, but they say you're to blame for the death of a patient.
Angela Strawberry. That's because I am.
Anyway, without Karen Taylor's medical records, I don't see how we've got much of a case.
What do they say about the notes?
Still the same. Lost. When it's their word against ours, the notes amount to the whole case.
I could try and get you the notes.
Mr. Lake, please be careful.
Do you have to escort me everywhere I go? What if I need the toilet?
Very good. Sorry, love, he just wants to get some things off his desk.
Oh. Okay.
All right, mate. I'll be straight with you. I haven't got a desk. She's my bird. I need to talk to her. Come on, you know what it's like. Give us a couple of minutes, eh?
Young love.
Cheers.
Rob!
Christ, Anne-Marie, don't call me back in. Please.
gently. Okay, so Donna, it's really low earth to Sister Ricks.
Sorry.
What we're looking at is a very...
Okay, last one, bed 6, Eunice Harris. 1 day post HSO under Mr. Hurley. Eunice had some lower abdominal pain today, but she is responding to Voltarol. So, and that's that. Is anyone aware of there being some kind of complaint on the ward from a patient, a relative, a member of staff? I've seen Mrs. Pringle talking to some of you.
We've been ordered not to talk to you about it.
What's this all about?
Well, like I said, we can't talk to you about it.
Come on, I've got a right to know. Who said something about me?
Sorry.
Well, who's reported me? What am I supposed to have done? If someone has a problem with something, they can come and talk to me about it. Tell me. Kat! How can you know something and not tell me?
My family were all very good Soviets.
I'd like to thank the representatives of Bing Stornoway Carroll, particularly as they've laid on some booze and grub for later, although they've assured me that they contain no experimental substances. Now I'd like to hand you over to Polly Gray, my specialist registrar. Polly Gray.
Thank you. 40 women aged between 19 and 49 years, medium age 32, were enrolled as trial subjects, each receiving bisphenophil, 10 milligrams orally. They were instructed to ingest the drug 2 hours prior to sexual activity, and their responses were subclassified as desire, arousal, and orgasm, and quantified by self-assessment scores of 1 to 10. The red blocks show scores at the time of enrollment, and the blue blocks show scores after 4 weeks treatment. I am pleased to report that this pilot study promises a valuable role for bisphenophil in the treatment of female sexual dysfunction.
We've cleared the lawn, so they can start... No, thank you very much. They can start digging the swimming pool at the weekend. Now, I have given it a lot more thought, and I still do want it shaped like a vag. Excuse me one moment, thank you. Well, I hope you liked it, because the other consultants, they're badgering me about the cappuccino machine. I thought maybe with a plaque, you know, donated by Bing Stornoway Carroll in association with A.J. Whitman. Excuse us, would you, just for one moment? And the Oscar for best performance by a leading registrar goes to... So, the Caribbean, don't you?
Sounds very tempting.
Look, Polly, I'll be blunt. We'll save embarrassment later on. When we get to St. Lucia, I'd really like you to sleep with me.
I don't want to.
No sweat.
Do you know how much trouble I'm already in?
I need you to claim some notes for me from the management unit.
Fuck off.
Oh, come on, Paul. You know what's going to happen to me if they keep me on leave long enough. Okay, I'll get dumped off the training programme. I'll be a special needs registrar.
I don't even know where the management unit is.
Can't miss it. Biggest building in the hospital.
Yeah. Roger, I've been waiting for the right time. This Polly questioning your management of her delivery.
More than questioning.
Yeah. Yeah, she did. She knows she made a complete tit of herself, and I've given her a real bollocking.
She accepts that she was in the wrong.
Oh, yeah, completely.
The lady on ITU, she really is your patient, you know, Tony.
She's a very heavy pencil, Roger, at the moment, in the column marked death.
Well, I don't make the rules.
No. No, you don't. So I can tell Polly it's cool. Yeah?
Lady on ITU is yours?
Excuse me, are you Mr. Whitman?
Yeah.
Hi, I'm Tom Gorman, anaesthetic registrar covering ITU. Hi. We're conducting a trial, and we think this patient, Louise Weiser, might be eligible. We're looking at the management of cerebral and oxic damage, and we're beginning a trial of a membrane stabilizer called Substance K.
What Substance K?
Last year, there was an anecdotal report of it improving outcome in cerebral and oxic damage. A pilot study in the Netherlands cautiously supported a role. So we'd like to get involved in the first UK trial.
Oh, yeah, something to do with breast milk or fanny batter or something, and nobody really knows or cares what it does.
Still, before we bother the family for consent, we wondered if it was okay by you to enroll her.
Well, she's virtually a cabbage. You could prescribe voodoo chants for all I care.
Do you think I practice voodoo?
No.
So why did you say it then?
Yes, you're quite right. I apologize for that.
Do you think this new drug can help her?
It's at least as effective as a visit from Eminem.
You've got to make them give it to her.
I'm sure they will.
Thanks.
Is somebody from Mortality and Morbidity visiting her?
No, Marshall Mathers.
Yeah, which department is he from? Yes, Eminem, I know, I'm with it.
The daughter was wondering if we could bring him in to raise her from the coma.
Does it have to be Eminem? I don't like him. Maybe Dido. I like Dido.
I think the object is to lift the coma, not deepen it. I'm Polly Gray. I've been advised that you're holding a set of notes on an old patient of ours, and I have to present her case at the Mortality and Morbidity meeting tomorrow morning. And I just need to have the notes for a couple of hours to prepare my talk.
Wednesday. Certainly, madam.
One of our nurses has reported a serious incident involving our son.
What's he done?
Nothing. Someone said
Is there a problem? Won't they consent to Substance K?
Oh, no, I don't know what that's about.
Well, when will you start giving it?
We've done the paperwork.
Well, if things need chasing up, I can do it for you so it can start today.
Whoa, I'll let you know, all right? We're just replacing Louise's arterial line after the previous one blocked. When a patient's been in this condition for a long time, sometimes they get a bit bunged up. And we have to turn her regularly as well to stop her getting bed sores.
We've looked into this matter thoroughly and have found no evidence that you intended your actions to be racist or that they were perceived by the subject of the action as being racist.
I'd like to know what I've been accused of.
Well, that doesn't matter now. However, we have received a complaint of harassment. Now, do you deny, sister, that you interrogated nurses on your ward regarding their comments to this inquiry?
I wouldn't say interrogated. I wanted to know what I had done, allegedly done.
We take harassment very seriously.
Who said I was harassing them?
Sister, please. We have decided to enter a note of demerit in your employment record. Now, what this means is that while there was insufficient evidence to institute disciplinary action against you, your chances of promotion will be seriously diminished, with consequential capping of pay and pension terms. Now, you may appeal against this decision, but I must warn you that if you do so, we will have to conduct a more thorough inquiry, and that will necessitate your suspension.
Kat, can I have a word, please? Could you reassign me from looking after Eunice Harris?
Yes.
May I ask why?
We thought it was for the best.
I am not racist, and this is my ward. I make the assignments.
Okay, sure. You're the boss.
Was it you?
Me?
Yeah, you. Did you report me?
No, sister, you know. That's harassment.
Thanks, Polly. I mean it. I owe you a very, very big curry.
I'll hold you to that. Good luck, Rob.
Thanks.
Yes. No, they're both here now. The Taylors are still on their way in. We'll have to start without them. This is a copy of Karen Taylor's medical notes. Ever since I began representing the Taylors, the hospital has maintained these notes were lost. They've been recovered and copied. A similar case 3 months ago was settled for £2.3 million.
I'm prepared to testify that Roger Hurley was negligent in his handling of the Taylor case.
Roger Hurley's mistakes killed their baby and brain damaged Karen. I will further testify that I presented you with a report cataloguing numerous acts of negligence perpetrated by Mr. Hurley since his appointment. A report that you so far failed to act on. Mr. Lake will testify to the same effect.
Rather than entangling the Taylors in years of legal action, I am hereby petitioning the Trust to settle out-of-court damages in the sum of £3 million.
I'd like to be reinstated to my post, a specialist registrar in obstetrics and gynecology.
I would like to be reinstated to my post of consultant in anesthetics.
Well, thank you. If you wouldn't mind leaving us, we'd like to deliberate in private. Anyone else?
No, thanks.
Roger?
No, thanks.
Roger, I understand you've requested a locum to cover Mr. Lake's extraordinary leave.
Yes, that's right.
Well, I don't see why we have to pay someone to do his job when he could be doing it himself.
You're going to reinstate him?
What is it he's on leave for, exactly? The death of this Angela Strawberry woman, whose relatives aren't suing us, haven't even made a complaint. Why give ourselves the hassle? He's only a trainee. Push him out the door with glowing references. Pretty soon he'll be some other hospital's problem.
You're not thinking about doing the same with Maria?
Ah, consultants are harder to shift. You and your permanent contracts. Get it back in, will you?
Would you like to come in, please?
Oh, by the way, the chief executive wanted me to pass on that she's had a very warm feedback from Schmidt-Bremer regarding the new postgraduate center library. Apparently, they're very excited about your new trials.
Great.
How's it coming along? Are we going to get into the Lancet?
Well, I'm hoping to get into the British Medical Journal, but...
Very good. Lancet next time, eh? Mr. Lake, if I were to rescind your leave, you would have to sign a confidentiality agreement forbidding you from ever discussing the terms of your reinstatement.
Why do you keep denying what's happening in this hospital?
Mr. Lake, do you agree?
I'll have to think about it.
Do you think you're going to get a better offer today?
I agree.
You'll get written confirmation in the morning. Thank you, Mr. Lake. Miss Prentice, I'm sure you're aware of the complexity of the Taylor's case. Have you had much experience of medico-legal cases? I imagine not. It would be improper of you not to inform your clients that this matter won't be resolved without years of legal process. In fact, it would just add to their distress not to do so.
Every day, the Taylors are suffering because of Mr. Hurley's negligence. They deserve to be dealt with quickly.
Miss Prentice, I'd like you to inform your clients that I will instruct our solicitors to deal with this matter as expeditiously as possible. But they should be prepared for it to take years rather than months.
I have a copy of the notes. I have the testimony of 2 medical witnesses.
I'm sorry. But what reason have you given us to circumvent due legal process? Thank you, Miss Prentice. And Dr. Orton, I'd like you to stay behind if you wouldn't mind.
I had to take it.
Sorry, we had some problems. So, how's it going? It's the apology, isn't it? He wouldn't give it. I knew he wouldn't. Bastard.
Mark, they didn't give us anything.
What do you mean? We've got the notes in black and white, everything. Rob and Maria saying exactly what went on.
It's not enough. I'm sorry.
They're in there. They're in there now.
Mark.
You know what you did to us. I want you to say you're sorry. I want you to look me in the eye Hold up your hand and admit what you did to us.
Mr. Taylor, I've explained to you what happened. Of course, I'm sympathetic to Karen's condition and the death of your baby, but I was not negligent.
Mr. Taylor, please accept my sympathy. But now this is a matter for our solicitors and yours.
How can they do this to us?
How can they get away with this? Bastard! How can you do this to us, bastards?
Taxi for Prentice?
Can I give you some help?
We're okay. New people, you just walk away. You just walk away.
You have leveled serious allegations against a fellow consultant. But none of your consultant colleagues have come out in support of these allegations. We would like you to take some time to decide about your future. That's why we've dealt the way we have with your illness.
I'm not ill. I was never ill.
Roger Hurley's figures are no worse than any other surgeon in this hospital. There's no excess mortality or morbidity.
Oh, God! You people think that everything can be boiled down to a string of figures. Life is not that simple. Medicine certainly is not that simple, and you know that. Not everything that counts can be counted.
Maria, I just don't think you're ready to come back.
I'm the one barred from hospital premises. I'm the one. All the time, Roger's going about his business like nothing has happened.
Can I do it? Everything's gonna be all right now. Because we're giving her substance K.
not even going to say welcome back. What?
You not being around. I thought it'd make it easier for this thing to fizzle out.
Is that what you want? For it to fizzle out?
I don't know. I wanted it to be easy.
Didn't you ever just think, sod it? Why don't I bugger off and try something different?
Bloke works in the circus as an elephant keeper. His job's to clean out the elephant's arsehole. Every day he cleans out the arsehole, and every day the elephant shits all over him. His mates are like, please, pack it in. He's appalled and says, what, and leave show business?
Ryan, should we go around?
Hallie's on ward.
Rob? You'll receive a letter tomorrow, but you should know now that you're back at work only on the condition that you transfer to a post in a different health region within the next 2 months.
Nobody said anything about transferring.
You're given a glowing reference. It's standard practice when a hospital needs to be quickly rid of an incompetent doctor. This time next year, the year after that, I'll still be here. Where will you be?
Next time on Bodies.
Shit, what's happening?
What's wrong? Is the baby okay?
When you messed up that cry called Mrs. Strawberry, I covered for you then. There won't anymore.
It's been a pleasure working under you, Mr. Lake.
Help in room 1! Push!
Why do you want to transfer to a new hospital?
3 stars! 3 stars!
Does it?
Fuck the liar.
Hey, you can't come in here.
You screwed me.
You screwed yourself.